capacity as the chair of the Interagency Standing Committee Emergency Directors Group. He's also the Director of Operations for OCHA. He's been in this position since 2011. John, actually, prior to his current position, he has worked in a number of field locations. He was for over 5 years in Gaza as a director for UNRWA, the UN Relief and Works Agency for Palestine Refugees. He's also worked with the UN mission in Kosovo, with the OSCE in Bosnia, and also he worked with the Irish NGO GOAL, going back all the way to the Rwanda genocide. So, John, very welcome, and great to have you with us. I'd like to also present Sylvia Danilov, who is the Chief Humanitarian Field Support section at the UNICEF office in New York, which is part of the UNICEF's Emergencies Office. She has been in this position since 2012. Also, Sylvia comes also with a lot of field experience, having supported the operation in Haiti, but also having worked directly in postings in the Democratic Republic of Congo, in Somalia, in Myanmar. She's also worked with various NGOs and has also worked with the government of Switzerland. So, Sylvia, great to have you with us online from New York. And I would like to also introduce Domitille Galli, who is the emergency coordinator, and actually she's working primarily on the rapid response mechanism as a manager for the response in the Democratic Republic of Congo, and she's working with the Norwegian Refugee Council. Domitille, prior to taking this function in where she's based in Goma since 2013, in fact, she has been in the Democratic Republic of Congo since 2011. And before that, she worked with the International Rescue Committee. She worked with the French Development Agency and also with the Action contre la faim based in Paris. Great to have you with us, Domitille, on this webinar. So today's webinar is really going to focus on a topic which is, I know, very close to the heart of all of us, which is really about our ability to deliver in a fast way to the people in need, to be able not just to look into how we interact together and how we coordinate, but most importantly, how does it work, in particular with the rapid response mechanism. Are we really doing enough? Is there more to be done? What are the pros? What are the cons? What have we learned so far? And most importantly, I've asked all speakers to really try to be as practical, as field-specific, with concrete examples. I'm delighted to see that we have colleagues who have joined this webinar from over 51 countries this afternoon, from many operations in Africa and Asia. So we would really like to be able and hope that by the end of the webinar, you would have some concrete, specific steps that hopefully you can take and apply to your own operation with the ultimate view to be able to really enhance delivery and to be able to make sure that the people we care for, the people we're trying to help, get the fastest possible and the best quality of aid in place to be able to respond to the needs on the ground. So, as I said earlier on, I'm going to start with a few questions myself, but I would like to encourage you throughout the webinar to send us questions, which I will be taking to the speakers and asking to hear their reflections. I'd like to move actually to John, and to start, John, with you with the first question. And I'd like to ask you, in your capacity as the chair of the Emergency Directors Group, and I know you just came back last night from a trip in Nigeria and Ukraine, where you looked at the humanitarian emergency and the response in these areas. So what do you see as the different roles at the global and at the country level in terms of supporting this rapid response? How can we all basically join hand, whether it's from a global, and what needs to take place? What are the steps that are taking place to ensure that this fast response takes place? John, over to you.
Thank you very much, Panos, and good afternoon to everybody who's online. It's a great opportunity, I think, to have a discussion at this point on how we as a humanitarian community are actually moving forward on enhancing our capacity to respond rapidly. response has to really be at the center of our focus for everything that we do as humanitarians. It's about delivery. So to answer your specific question, Panos, I think the responsibility we have here at the HQ level is to make sure that we're providing the support. If we take the lesson from the transformative agenda of decentralizing and empowering the field, then the design of rapid response mechanisms should be field-based, it should be field designed, field-driven, and HQ should be very much in a supportive role. Of course, on the HQ side, we also have to make sure that we get the right people out to the field to be able to do what's needed at the field level. And there's where the transformative agenda again comes into play with the rapid response mechanisms for the deployment of staff and making sure that we have the right profiles on standby to be able to scale up quickly at the field level. We saw that really working well recently last year in the Philippines when we had the sudden onset crisis there, where unlike earlier experiences in the Philippines, in Haiti and Pakistan, we were able as a community to get the right people out on time with the right skill set and also with the sort of preparation that was needed to get the humanitarian operation scaled up very quickly. Now, that's one component. At the field level, we'll hear from our field colleagues about the details of how you stand up a mechanism to deliver at the field level. So I will leave it to them to describe what's involved there. But you did mention about the Emergency Director Group going last week to Nigeria and to Ukraine, and I think that's a classic example of field and HQ joining hands. We face very complicated and large-scale crises in both of those countries. They're evolving at a rapid rate, and again, by having an emergency director mission to both of those countries, it was an opportunity for HQ colleagues across the NGO and UN agencies to really be joined in real time to that reality, understand from the field perspective, listening to our field colleagues what they need of HQ in terms of support, and then for all of us to mobilize together. The HQ colleagues, of course, bring experience from elsewhere, having that global overview, and are able to share in an interactive way with field colleagues on mapping out the best way forward to scale up rapidly, and again, then to work in common purpose and with a common focus on making it happen. I think our community has to really become preoccupied with delivery. Over the last couple of years, we've done a lot to improve the processes, getting the coordination right, getting the organizational aspects of how we work together right. That was the transformative agenda. But now we really have to move to being preoccupied with the delivery, response. So that's why this webinar is so timely, so that we can again share where we are and continue hopefully on a good track to be able to deliver much more effectively, much more rapidly than in the past. Thank you.
Thanks, John. Indeed, I mean, your message that basically for the field to tailor-make the response and to be able to do it is very important. And indeed, we'll be hearing in a minute from Sylvia and Domtil in terms of how they have gone about doing this, implementing it in the different contexts. But surely from the global level, when a crisis happens, usually operations look what is available regionally, what is the global support that could come. This could be in terms of prepositioning. You're already mentioning about the human side, human resource surge capacity doing well, but also in terms of questions of material, of financial resources. This is all really very important. Most of the preparation for a good response has to be on the upfront side. So would you share a little bit your reflections on that, on what is being done or is available or isn't available at the global or regional level? Over to you.
Yes, indeed, Panos. I mean, that is actually the key components of the response. You mentioned human resources, the people, the humanitarians, the experienced experts to get out there quickly. That is a HQ and responsibility to make sure that we have the rosters, that we have the people on standby, that they are trained and ready to go. I think in that regard, as a community, we are well positioned now. And our last mega crisis, level 3 crisis in the Philippines, showed that we were able to get the people, the humanitarians, out there on time and able to do it. And we've been doing that in the scale up in many other countries in the interval as well. On the financial side, again, I think that we have really streamlined and put in place a lot of better systems, both within humanitarian organizations individually, but also collectively. For example, we have an automatic release of SURF funding when you have a declaration of level 3. Many of our humanitarian organizations also have internal prioritization for rapid allocation of immediate release of funding for rapid response. So I think on the financing side, in terms of mechanisms and so forth, we have done a lot, and we're in reasonably good shape there. There is, of course, the overarching issue of a shortfall of available funds for the huge number of crises that we're tackling, but that is another issue that we are also trying to deal with trying to get a realization at the global level of a greater priority for humanitarian action. Now, on the last one, though, which is the supplies, and that's where it comes to, the delivery. Getting the high-energy biscuits, the water purification tablets, the blankets, the plastic sheeting, the medical supplies. We don't have large stocks pre-positioned, ready for the next mega crisis. Why? Because of chronic underfunding. We're really working as a community from day to day, week to week, and this is where we're very vulnerable. So we have to work with that reality, which is that the most important days in any crisis are the early days. That's when people will die either for lack of clean drinking water, for lack of clothing, blankets, shelter, food, and so forth. So we really have to find a way of dealing with the fact that we don't have these mega warehouses pre-positioned around the world, and yet we have huge supply lines moving all the time. How can we tap into those and divert the key supplies that are required in a crisis? And the other issue that's coming through very clearly from the Philippines and also Pakistan and Haiti is that in natural disasters, you've got to anticipate that the infrastructure will be devastated, and therefore transportation will be a critical challenge, whereby you will be very reliant in the early phase on air assets. That means to get those supplies in the huge quantities from their point of origin to the point of de-embarkation, the country itself requires significant air assets, and then from there to the point of delivery, to where the people are quite isolated, it also requires different air assets. So helicopters are also now really a central part of any early phase humanitarian response. And in that, we are very reliant in the last crises on military, and we have to work to get this sorted out in a more predictable way, that we know that if there is an earthquake or a hurricane or whatever in a given place, that we will have the arrangements in place with the militaries that will enable us then to tap into their assets to actually move the supplies to where people actually are isolated, cut off, because the rest of the infrastructure, roads and rail and so forth, have been damaged in the crisis itself. So I hope I've answered, but there's obviously a lot more to say, but I will stop there. Thank you.
Thanks, John. Indeed, it's a vast area. I just want to point to everybody who's listening that you will see on your screen, and actually we have shared earlier on the webinar, a document which gives a little bit of a summary of the rapid response mechanism overview that exists at the global and regional level. It is certainly not a comprehensive list. It just gives a first cut of what is available in terms of standby arrangements with partners, search of staff, or stocks available. In fact, there is also a second document that also has been circulated, which you all have, which also gives a brief overview by agency in terms of what is available, while the first document really looks at it more by cluster. Clearly, whatever we do is really not enough, and a lot needs to be done in that area. I'd like now to take you from the global level and really zoom down and look at the specific examples. And I'd like to move to Sylvia, who is with UNICEF in New York. And Sylvia, I'd like to ask you, UNICEF took the leadership and really spearhead with a rapid response mechanism, a mechanism that has been put in action in a number of countries, is going on now for a number of years, it has evolved. I'd like to ask you, what really prompted the need to put up a rapid response mechanism? And then I could also ask you to really guide us through a little bit, how does it work? And when you describe it, really give us the ingredients, give us the recipe in terms of how you went about applying it. I really want to make sure that the colleagues who have joined us from various operations around the world, they get this step-by-step guidance in terms of how to put in place a rapid response mechanism in their own operation. Sylvia, over to you.
Thank you, Panos. Good afternoon, evening, colleagues and friends around the world. Bonjour, bonsoir, et salam. So actually, the RRM approach was initiated in the Democratic Republic of Congo 10 years ago. There was a recognition at the time that the emergency response of UNICEF, but also other partners, tended to be ad hoc and rather ineffective. Populations in Eastern DRC were constantly being displaced by armed conflicts or natural disasters. Yet, each internal displacement meant looking for a new partner to deliver assistance, each time mobilizing additional financial resources and supplies. As a result, there were lengthy delays in providing assistance to populations in dire need, and as John Ging was saying, the focus on delivery was ineffective. So the RRM in the DRC was established with the objective of delivering fast and efficient assistance to the most vulnerable populations. Based on the DRC model, which over the last decade has substantially evolved, there are today rapid response mechanisms in the Central African Republic, in Iraq, in South Sudan. In Haiti, we also used to have one RRM, but it has been discontinued. So the RRM shows tangible results. In the DRC, it reaches an average of 2 million people per year. In Iraq, 1.3 million highly vulnerable displaced populations were reached since summer last year when the crisis started. The South Sudan RRM model, where not one but several rapid response mechanisms coexist, has benefited more than 1.5 million people throughout last year. And the RRM in the Central African Republic is more modest. 100,000 people were reached in 2013. So as Panos asked, what are the key ingredients that are essential to the RRM recipe? I'll bring about 4 key such ingredients, but please don't forget that each RRM is adapted to the specific situation in which it operates and is not a rigid model. So the first ingredient is really the prepositioning of partners and supplies. In all the contexts, UNICEF has entered into direct partnerships with NGOs and funded them to maintain a full-time emergency response capacity. In fact, the RRM designs departs from conventional emergency programming, and it is essentially a contingency mechanism. Indeed, the RRM partnership doesn't specify where, how, and when exactly future interventions are going to happen. These are agreed upon based on the vulnerability assessments undertaken in response to fast-evolving emergency situations. Today, we have more than 15 key INGOs that are directly partnering with UNICEF in the 4 countries where the RRM is in effect. There is an average of 70 dedicated INGO staff for RRM in the DRC, 38 in the CAR, for example. In South Sudan, there are about 60 rapid response teams, some directly funded by donors and led either by UN agency or directly by INGOs. And then, of course, large quantities of relief supplies are pre-positioned in country, and costs for logistics and transport are pre-financed. The second key ingredient is the continuous capacity for vulnerability-based assessments. All RRM partners today have the capacity for maintaining a humanitarian watch based on their geographic coverage and access to wider alert system. This information triggers the implementation of initial multi-sectoral needs assessment. These are actually mostly locally adapted versions of the MIRA and enable to score levels of vulnerabilities in key sectors. In Iraq, we have the Open Data Kit, which is feeding directly into the OCHA database. Today, half of the over 2,000 locations assessed by humanitarian partners in Iraq have been assessed by the RRM partners. In the DRC, we have multi-sectoral assessments, and those are seen as increasingly reliable sources of information, for example, for the HCT and all the key humanitarian partners. The third ingredient is really the rapid multi-sectoral emergency response. The response should be triggered when no other actors can intervene. Practice shows, however, that the RRM has sometimes evolved into a de facto intervention of first resort. The most basic RRM package is implemented in Iraq. Either the RRM partners, that means the INGOs, or UNICEF or WFP staff directly, when no partners are present, distribute the so-called portable lightweight kits. And these are comprised of an adult hygiene kit, drinking water, immediate food response ratio, as well as buckets and jerry cans. And the items should be sufficient for a family on the move for about 7 days. In South Sudan, the RRM that is managed by both UNICEF and WFP aims to contribute towards reducing malnutrition. It includes vaccinating children, administrating vitamin A supplementation, undertaking nutrition screenings, and providing training to support capacity building of partners and community workers. And in the DRC, over the years, innovations have refined the response package. NFI, non-food item fairs, are taking place, and today 70% of the non-food item response is cash and voucher-based. And this has contributed to lower the cost of about 20% of all the supply and logistic costs involved in the response. There is also in the DRC strong component of emergency education response and also health mobile teams. And in the DRC, we have an integrated practical approach to identify and meet the needs of people with disabilities, mainstream gender, and also facilitate an increased participation of affected populations. Finally, the fourth key ingredient is the interagency coordination and governance structures. Those structures are actually similar across all the contexts. On a weekly basis, UNICEF meets with INGO partners, OCHA, other participating agencies such as cluster lead agencies, and also donor representatives. They analyze incoming humanitarian alerts, multi-sectoral assessments, and decide whether assessments and/or further interventions are needed. So the governance structures also include, in a more systematic manner, cluster lead agencies and broader stakeholders. In that regard, the South Sudan model is a bit different. Cluster coordinators are involved more directly in the coordination structure, which is facilitated by OCHA. And in all these contexts, The RRM partners are systematically sharing information with the HCT and intercluster coordination fora to ensure the complementarity of interventions. We have seen, however, lessons learned and evaluation showing that the integration of RRM activities with other interventions, more specifically food, health, and also protection, is weak. We sometimes say that the casserole est pas la nourriture, with the pots without the food, and so we have to really strive to ensure an integrated response to populations in need.
Thank you, Sylvia, for this overview, which is really fascinating to see how you have taken the response and basically the model adapted it, designed into each context. Also, thank you for putting together the paper that was up on the screen a minute ago. I want to make sure you have all seen it, which really provides a bit of a comparison in between the DRC, CAR, South Sudan, Iraq, and Haiti, and how the difference is in each operation. Reading the paper and listening to what you have said, if I can summarize it, I hear you talking about 6 steps or 6 points that if colleagues listening want to take it to their own operation, these are the 6 steps that really they should put in place. The first one I see obviously is the pre-financing, the funding, the fact that you have spoken to a number of donors in your own operation and made sure that you have an amount, and that is enough to buy and lead into the second point, which is really pre-positioning, buying a number of NFIs. If you're listening, you're attending this webinar in a country which is really disaster prone or conflict prone, and you have often enough displacement, then really it is very helpful to seek a pre-financing, which is step 1, to pre-position and be prepared, which is step 2. A third point you talked about is the partners, having pre-identified the NGOs, national, international, whoever it is that is best positioned, has the capacity, and have agreed with them about what they need to do. And what you talked about, a governing body, a light mechanism, where basically you sit with your partners and you review, you agree on what is it that they will be doing. So that's the pre-identifying the partners is the third one. The fourth one, what I heard you talking about, is maintaining a humanitarian watch, kind of keeping an eye on how things are happening and how the political security development or the natural disaster affects, so that you can really respond to the operational reality as needs arise. And this is crucial, particularly in operation where things change quite often, to be able to have that ear on the ground to be able to respond. The fifth area I hear you talking is about the light needs assessment. I see in the multi-sector how you go about doing that, and then of course the delivery itself being the next step for the final of the 6 steps to be able to deliver. I also heard your own self-criticism about the protection being weak. We're going to come back to that in a second, because I really would like to hear more on the protection side. But in the meantime, I would like to bring in the conversation Domitil, who is in Goma, working with the Norwegian Refugee Council. She has been in DRC for a number of years, and actually she has been quite involved in the response. She's the manager of the Rapid Response Mechanism in the field. So, Domitil, I'd like to ask you to give us your perspective from an NGO perspective. It will be interesting to hear how is this working in the Democratic Republic of Congo. What is the role of the NGOs? What is your assessment of it? It will be good really to hear your thoughts and reflections. Domitil, over to you.
Thank you very much, Manos. Thank you, Sylvain, for the presentation. And I would like to do just a little focus on DRC. So RMP in DRC is implemented in 4 provinces at the eastern part of the country. And in each province, it can be 1 to 2 international NGOs that are delivering multi-sectoral assistance in different sectors that can be health, education, NFI, and WASH. These 5 international NGOs are Solidarité, Save the Children, IRC, AFC, and ANRC. The total budget for 2014 was $36 million, and the coordination between all the NGOs is really important. So basically, when a crisis, for instance, is too big to be covered by only one NGO, two actors are responding jointly. So at this moment, RMP is one of the most effective models in place so far to reach emergency needs in DRC. Thanks to the capacity, thanks to the fact that we have the capacity to mobilize very fast human resources and capacities, as Sonia presented. Even if for sure some improvements are always required, as on the rapidity aspect, RMP is nevertheless recognized in DRC as an effective and efficient program. Just to give you an idea, in 2014, we, RMP, all the partners, we did more or less 500 multi-sectoral assessments, 600,000 people have been assisted in NFI, 430,000 in health, almost 300,000 in WASH, and 170,000 in education. So I would like, as an NGO partner, to emphasize three aspects of our work. First one will be the early warning or the humanitarian watch. Second one, the importance of coordination in terms of interventions. And the last one, assistance itself. So if I can begin with humanitarian watch, DRC actually is a very volatile context and unpredictable. So this requires a constant follow-up from NGOs. So depending on the provinces, but more or less RMP can receive 5 alerts per week, and it can't cover all of them, even if it would be necessary to assess the zone and eventually respond. So NGOs are responsible to do a permanent follow-up on the emergency situation in their respective provinces in order to be able to prioritize crisis and alerts and decide where is the needs are the more urgent. This analysis is based on the size of the movement, on the analysis if the movement is ongoing or over, if there is any intention of return, so if it's appropriate to respond now or not, if we have the access, for sure, security and logistic one, if there isn't any protection risk for the population, the beneficiaries, we analyze also all the donor aspects, etc. So in this particularly volatile and unpredictable context, displacement can last from 1 day to a year, and IDPs can move to camps or in host families. So one of the main responsibilities of our RMP partners is to make sure to have an overview of the situation of their province, and through a network based on OCHA, local partners, other NGOs, local authority, to be sure to assess and define the priority in terms of alerts and in terms of response. And once the multi-sectoral assessment is done, each NGO will share the report with all the humanitarian community. So RMP is doing the humanitarian watch for all the humanitarian community, not only for itself. A second point was the importance of coordinating intervention. So at this stage, once the multi-sectoral assessment is done, considering again this particularly volatile context, and based on multi-sectoral results, prioritization is still required. So that means that context could have changed since the multi-sectoral assessment, or maybe other crises could have flared up. So we need again to prioritize. And this is a proactive role of NGOs during the weekly steering committee to define with other actors the multi-sectoral response, the most appropriate one, among RMP partners, but also with other sectors not covered by RMP, as food, for instance. So this process is supported by OCHA, by UNICEF, and all the customers. And this coordination, it means that we have to be coordinated for the whole project cycle, from the assessment, going to targeting process, selection of the modalities, delay, and all the general approaches in order to make sure that all the do-no-harm aspects are analyzed. And finally, one of the particular aspects of RMP in DRC is that about the experience of the program. So RMP partners' role is to be the most reactive delivering assistance, for sure, but without compromising the quality. So mainly analyzing very well the context and the donor aspect. So thanks to the flexibility of this program, and after also 10 years of existence, RMP partners and UNICEF are always looking for improvements in terms of approaches, methodologies, and procedures. So for instance, Sylvia was mentioning this has conducted to a new targeting methodology approach based on vulnerability and downward status, or FAIR, NFI FAIR, that it was a new methodology. Now assistance is going to be adapted to the size of the households, and other pilots are going on. So RMP, us as NGOs within the RMP, we are really proactive, and we are really encouraged also in always looking for the most appropriate way to respond to the needs.
Thanks, Sylvia, and it's good to hear this self-reflection also on what needs to be changing. I welcome very much also the questions we're getting from listeners, and I want to encourage all of you who haven't, or you have a point of view to share, really to go forward. And indeed, one of the areas that has been of criticism or questioning is really the question of protection in the rapid response. And I'd like, John, actually to come to you and ask you about, in this rapid response mechanism where we really try to do everything, several people have said the centrality of protection is really not at the heart of the response itself. So what's your reflection and reaction on this? And I'm actually going to come also to Sylvia after that to hear her views as well. John, over to you.
Thank you, Panos. What defines us as humanitarians is that we do our work in accordance with humanitarian principles and international humanitarian law. So the centrality of protection cannot be overstated. It's essential. And what is really, I think, very positive about this new initiative, this approach to enhance, through our better working together, a more effective and rapid response, is that protection is at the heart of the response. And we find that in everywhere where this mechanism has been rolled out. For me, having visited a number of the countries, DRC, Central African Republic, Iraq, seeing how this is functioning and the importance given to protection issues in the response is very heartening. I did see, though, that, for example, in the Ebola-affected countries, where we didn't have the conventional approach, which is our humanitarian architecture rolled out in its traditional way, that there were gaps on protection. So there is a compare and contrast. I want to also be very clear. I think the Ebola response has been a heroic response by every organization who have stopped that catastrophe in its tracks. So I don't want people to misinterpret what I'm saying here as a criticism, but I do see very clearly that there were significant protection gaps there, very specifically just when we see humanitarians going in an intervention in their traditional format, as these mechanisms are being rolled out with protection at the center, we see that people are at the center of the focus, and the issues that fall out are much more than just delivering supplies or treatment. It's the host of issues around that and making sure that, as I say, the centrality of protection. So again, I'll stop there because I know the colleagues will have much more to say. Thank you.
Thanks, John. You mentioned Ebola, but also looking actually at the rapid response mechanism in the countries that has already been rolled out in South Sudan, in DRC and so on. These are really conflict areas where, of course, there's a number of victims, civilians, people are really at the center, at the heart of what is really happening. And often the more soft elements of the impact are the ones that are more difficult to see and respond. I'd like to bring Sylvia into this conversation. And really, Sylvia, if you can hear your reflection in terms of the rapid response mechanism, is it really only about delivering material, or can it be designed in a way to be more holistic in terms of supporting, to make sure that there is a people-centric approach in the way we go about it, and of course the protection issues that often affect the most vulnerable, women, young girls, or minorities within societies. So Sylvia, over to you.
Thank you, Panos. Indeed, the basic package of the IRM interventions is focused on delivering essential life-saving supplies. Oftentimes, as we know, windows of opportunities for interventions are time-bound due to high insecurity and access constraints in all the contexts where the IRM operates. It is hence difficult to implement interventions requiring longer-term presence. But that also depends on the maturity of the IRM mechanism and its ability to prioritize an integrated response to acute vulnerabilities. And I think Domitil has spoken about some of the holistic and integrated approaches we are implementing in the DRC. Let me take the example of South Sudan, where the UNICEF and WFP IRM uses a nutrition lens to prioritize locations for interventions. It complements food distribution with nutrition screening and treatment referral, access to safe water, and life-saving immunizations. And indeed, despite short-term interventions, IRM partners in South Sudan are always aiming to identify former teachers or healthcare staff within targeted communities, and they provide them with incentives, salaries, refresher trainings to enable them to continue to work. So that goes beyond the delivery of supplies only. Now let me get back to the question of protection, and I fully agree with John about the centrality of protection and the humanitarian community facing today mostly what we call protection crisis. The IRM was not initially designed with a protection lens, but over the years, and as the IRM intervenes mainly in such protection crises, it has become apparent that it is essential to better articulate the IRM role in preventing and responding to protection violations. And there are now ongoing efforts to mainstream protection in the overall IRM approach in all the four contexts. But I must say we are at the very early stages, and we need to even strengthen our collaboration with the protection cluster and protection partners. Let me just tell you that last week there was a training of trainers for IRM implementing partners in the Central African Republic, and that focused on the integration of protection aspects in the multi-sectoral assessment, and also strengthening the capacity of partners on how to recognize protection issues, how to include those protection issues and report on them as part of the IRM response. Unfortunately, in the Central African Republic, referral mechanisms for protections are very limited. But it's been agreed that when an IRM implementing partner is concerned about a protection issue, it will be reported directly to the protection cluster, and actually the protection cluster participates in the weekly coordination meetings of the IRM mechanism. And also the same discussions are currently taking place in Iraq between UNICEF, IRM partners, and the UNHCR. We unfortunately anticipate that the next waves of displacements in Iraq will require rapid follow-up by protection cluster partners coordinated by UNHCR, and we're currently discussing the complementarity of the approaches with the IRM interventions.
Thanks, Sylvia. It's interesting to hear your own acknowledgement in terms of areas on the protection, how to bring it further on board, and the efforts you're referring to that are being made indeed to take it more online. So I'd like actually to move into the reflections of the lessons learned of the mechanism so far. And I'd like to go back to Domitil in Goma. Domitil, I mean, you've been implementing the rapid response mechanism now in DRC for several years. It's the longest running rapid response mechanism. And of course, it has changed, it evolves. You mentioned how you tailor make it as you go along. So at this very point, what would you say are kind of your main lessons learned, and what colleagues who may be designing it elsewhere in other operations could take on board in order to better design it, tailor-making it in their own context, but in order to avoid possibly making some of the same errors? So what is your own points that you would like to share for colleagues to be wary of and the lessons learned? Domitil, over to you.
Thank you. From the last few months and years, we have changed actually our global approach from a status strategy to a vulnerability one. That means that we realize that displacement affects also host family or host communities, and they need to be included in their systems. So until a few years ago, we don't have refugees in DRC, we only have HCTs. And so people are moving from a place to another, but maybe the host family or the host community will be as vulnerable as displaced people. So now we changed totally our strategy, and we are now working with a vulnerability approach and no more with a status strategy. So this was an important lesson learned from the program. A second one will be that even if for sure a program is a rapid response mechanism, but we are more focusing on quality. That means that rapidity is part of the quality strategy, and it's an important indicator in terms of efficiency and impact, but it's not the only one. So according to the DRC context, we have to be very precise in terms of analysis, being sure that we are responding at the appropriate moment. And accountability framework, protection checklist, ML system have also been developed these last years in order to improve the quality of the program. A huge effort also has been done in terms of standardizing and harmonizing approaches among the RMP partners. So it used to have, like, in each provinces or each partner was adapting procedural approaches. And so now we really work in order to guarantee the coherence of the program. And RMP is now recognized as having a unique strategy in all the different provinces. And so every year we have a global workshop, we organize also technical workshops, just to make sure that all the partners have the same understanding of the procedures and activities. Another lesson learned will be, for us, the importance of coordinating food and NFI systems. Firstly, in order to maximize the impact of the systems, as methodology are similar. In DRC, RMP is not responding in food. This is why coordination is so important with food security actors. And now it has become a common practice. So food and NFI, they're actually doing individual targeting. And for these two principal needs, if one is arriving a long time before the other, or if targeting process has been done with different approaches, it will reduce the global impact of both sectors. As beneficiaries, for instance, will sell part of their assistance in NFI to cover the need in food, or contrary the same. And it's seen incoherent also for the beneficiary community. So this has been a huge, and it's currently still going on, a huge challenge. Finally, I will say that RMP is really recognized as a humanitarian laboratory. That means that lots of innovation tested within the RMP have then been scaled up in DRC and used by other humanitarian actors. So thanks to the flexibility of this mechanism that gives us pre-financing, human resources and capacity available, we are also encouraged to test innovative practices which can be then scaled up if it's a success. So RMP is really like a flexible and innovative program.
Domitil, thanks for that, and I'm glad you mentioned in particular the question of food and non-food items and how does it fit in the rapid response mechanism. I want to acknowledge actually one of the listeners sent us a message saying that in fact in the DRC evaluation food and NFI items was not coordinated and was not part of it. So really it's good to hear that in your lessons learned you're saying that it should be joined a lot more in order to maximize the impact of the assistance and to be able really to respond in a more comprehensive, and within that laboratory, you call it humanitarian laboratory with lots of innovations to really be able then to see how to further tailor make the approach. From what I hear also from Sylvia, I mean, the rapid response mechanism covers a number of areas. It is not the answer for everything. I think the beauty of it is to be able to move fast, to be able to deliver. Is it comprehensive enough? Not at the moment, but yeah, I hear you saying about the efforts to be able to do that, to be more embracing of the others. Now, I would like to bring Sylvia back in this conversation, because clearly when we look into all this innovation, new approach, I mean, questions of leadership, questions of risk-taking is really important, and this is happening in an environment where I have to say we're becoming increasingly more and more risk-averse. So this is really an interesting initiative which has also evolved in various operations. So Sylvia, what are your reflections?
Thank you, Panos. I think, to continue on some of the lessons learned, for sure, the RM requires a certain level of risk-taking and operating outside of the traditional way or out of the box. And because it requires the ability to anticipate humanitarian needs and plan for an adequate response, maybe supply prepositioning, human resources, and financial capacity to respond. Also, in contexts such as Iraq and South Sudan, when no partners are present in some of the newly accessed conflict areas, direct implementation by UN agencies has become the norm. And this required that the agencies, including, and I can speak about UNICEF, we need to review our own modus operandi and internal rules to facilitate such approaches, and also minimizing some of the risks and having a clear risk management approach in such context. A second aspect that you mentioned, Panos, also that is key for the RRM, and I think at the core of its success, is that there is the need for a strong leadership and partnership as the core of the RRM approach. Whenever and wherever UNICEF has led and implemented the RRM, we didn't do it alone. We need strong INGO partners from the design to the implementation phase. We need support from OCHA on information management and coordination. Also, ideally, the engagement of all the cluster lead agencies from the start, even though in practice, I think it's not always possible to secure the buy-in from the whole HCT. And this may even, in some cases, affect the slowdown of the RRM initial establishment when we are focusing on the response. In the long run, however, without strong HCT and clusters engagement, the RM impact is limited. And also, finally, let me also mention the importance of donors' involvement and buy-in as extremely valuable. In the DRC, over the years, we have had a very strong donor base. And I can also recall the Haiti example, where we have discontinued the RRM, and one of the causes is maybe that we have not been able to engage and attract donors and give them a real place in the RRM design and implementation.
Thanks, Sylvia. I'd like actually to move back to John. And John, I want to ask you, if a country wants to set up a rapid response mechanism, where can they go? Is there like a central model, or how does it work? John, over to you.
Well, Panos, on this one, we are very much decentralizing to the field in the true spirit of the transformative agenda. We're not setting up mechanisms at the global level which will seek to somehow make it even more complicated to adapt and adjust to not just the local operational circumstance, but also the local capacities. The concept is, as Sylvia and Donita have outlined, it's very much focused on response in the context that we find ourselves in. It does require, of course, leadership. It does require good collaboration. And what we will be advocating moving forward is that the HCT and the HCs take more ownership to really position themselves to be fully supportive of this initiative, and also we move away from the flag waving that everybody has to be on every rapid response initiative, that certain organizations have institutional core capacities and competences which they're putting at the disposal of the entire system at the country level, and we need to capitalize on that, and we need to really use the good practice now that is developing in these countries where we are seeing this mechanism to succeed, learn from those good practices, and then share them with other countries, so that first and foremost we don't have to reinvent the good things, but also that we learn the lessons from the areas where we find we have shortcomings. But my message on this one is overall from a HQ perspective that HQ has to obviously play an important role in providing support, sharing, facilitating the sharing of best practice, making sure that we're doing the training, and also the other support that we can provide in a way that does not actually restrict or limit the discretion, the flexibility, the adaptability, which is the real success at field level, as everybody out there knows. If the field are given, the support to get on with their work, they very much appreciate being given that latitude, and at the same time, they do want to feel that they can draw on the support that they need to be optimal. So my message on this one is that we are really following this with great interest at the HQ level. I've seen it myself on emergency director missions to DRC, to South Sudan, also to Central African Republic, and we have, as an emergency director group, we have really admired how our colleagues have taken the lead on this at field level, and we will continue to promote that approach, which is that it's a field-led initiative supported by HQ. Thank you.
Thanks, John. I'm actually going to stay with you, and I have one more question that we got from Caroline Nichols from Interaction, who's saying, do we have enough sufficient rapid response capacity given the scale of needs observed over the past year? If not, how can this be further augmented, our global capacity to be able to respond? John?
Well, Panos, I think we have to acknowledge that in this area we have taken great strides in the last couple of years, certainly since Haiti and the Philippines, or the Pakistan floods in 2011, putting in place the interagency rapid response capacity at the global level, where the key functions that are required to respond in crises are pre-identified. The surge rosters are populated with the necessary people of the necessary skills and experience. So I would say in the first instance we have come a long way in pre-positioning people, being able to have the necessary surge capacity for rapid deployment. At the field level, we are quite stretched with all of these global crises. So while we have the ability to surge quickly on scale, The challenge becomes how to sustain that in the medium term, and we find a lot of gaps in the field. So as a community, we need more staff, we need more experts, we need to build a better base, a broader base, a deeper base. And that's, I think, where at the HQ we have work to do still to be better in terms of being able to get more people into humanitarian action, train them up to be more effective through enhanced training and sharing of best practice and so forth. But I would at the outset though say that we've come a long way. For example, if we were back in 2010 with the capacity that we had then, trying to cope with the multiplicity of crises that we have today, we would have been overwhelmed. You know, our starting point is that as a community, we should acknowledge that, you know, while we are under a lot of stress and under a lot of strain because of the unprecedented scale and complexity of humanitarian demand that's out there, the community is doing well overall, but it's no place for us to be complacent. We still have a lot of work to do to actually get to where we need to be, and one of the areas is broadening and deepening the base of humanitarian staff across the world. Thank you.
Thanks, John. A lot of progress, but a lot of work still to be done to catch up with the crisis. One can even say that the deterioration of the crisis even happens much faster than our ability, which puts us really in the situation where we are. I have actually another question, which I'm going to ask Domitil in Goma, and the question really comes from Neil Bunyi from UNDP, who is asking about the quality of the rapid response. And his question is, while we're responding and providing all this life-saving assistance to people in need, how do we make sure that we avoid kind of an over-dependency, that inadvertently we're creating really more vulnerability over the long term by creating this kind of continuous need for humanitarian aid and support? So, Domitil, how do you link this quality of the response with the linkage with vulnerability and a little bit of a longer-term planning? What are your reflections? Over to you.
It's a very good question. Honestly, when I was talking about quality, I was more thinking about accountability, protection, mainstreaming, analyzing do no harm, being sure that it's the proper time, having a vulnerability approach, a status approach, etc. So we are working on this. If I really want to be honest, we don't have a proper exit strategy. So we are trying to adapt our methodologies. That means, for instance, we are doing 80% of NFI fares instead of NFI distribution currently. That means that people have the choice to choose what they want. So maybe it will help us better after intervention, or during education activities. We are working with parents committee, with the school committee, so we are trying to involve as much as possible the community within our activities, same in health and in WASH projects, but we don't have a real and a proper long-term strategy, exit strategy, I mean.
Domitil, thanks a lot. I'd like actually to move to Sylvia, and there's a question actually we got from several colleagues who have asked the same question, and this is about how does the rapid response mechanism fits with the existing system, whether it is the cluster, the interclusters, the effort by the collective to work together. Is this a parallel? Is it a closed doors club? How does it work? If an agency which is not part of it wants to join, is that possible? How ambitious? How does it fit in with the HCT, with the clusters, with the system? Sylvia, over to you.
Thank you. It's an important question, and I think it goes to the core of, the need to coordinate the RRM with all the other partners, and also the question of the partners that are able to provide more of a, longer-term approach, because the RRM is really very rapid response to immediate needs, and at the same time being able to respond rapidly. You know, one of the lessons has been that if we want to practically start an RRM, we need to first have a few key agencies, INGOs, and committed donors who can run with the idea and also invest some of their resources to make it work. In all the instances where the RRM has been established, the focus of the initial phase was to demonstrate rapid and quality emergency response. And I must say, not always investing so much time and energy in establishing ideal coordination and governance structures. Once the RRM has shown results, then I think the phase has been in parallel to have discussions with all the other partners to see how we can be complementary to some other existing mechanisms. One of the participants was mentioning the IRC managed cross protection response in the DR Congo, some of the protection mechanisms, health rapid response, and the mechanisms that are coordinated by other clusters. But we always have to have a balance between the focus on the response and also trying to find coordination mechanisms with other partners. Now I must say that all the multi-sectoral assessments that are implemented are very much fitting into the intercluster multi-sectoral assessment, MIRA, for example, and the response is always in conformity with the response that is being discussed at the HCT level in all the 4 countries where the RRM operates.
Thanks. I'd like actually to move to John and ask a question. We're getting callers basically describing what I would call a mission impossible situation. And it's really about how do you respond in a context, and this question comes from Latin America, but it could be in many other parts, where you have displacement, in particular in urban settings, but also it could be in any setting, where basically there isn't any donor interest to be able to fund it. There is no political interest from the host government to be able to accommodate, to respond, and to support. And at the same time, these colleagues in these operations really feel desperate because they see the humanitarian need on the other side. They clearly see what needs to happen to respond to this need, yet they don't see much really support either at the local country level, even at the regional level. So how do you get with these impossible situations where the political interest is not there, the funding is not there, yet the need is really very strong? John, over to you.
Well, Panos, the good news on this one is that we do have the Central Emergency Response Fund, and that is precisely what the fund was put in place to do, where there is a deficit of political support and where there's a deficit then consequentially of funding for the obvious needs. You have the rapid response mechanism of the Central Emergency Response Fund if something has happened suddenly. Equally, if a crisis is being neglected, you have the underfunded window. So I would say on the funding side, we do have an effective mechanism at the global level. It's $500 million of money that is predominantly to go to these type of circumstances where either something suddenly happens which is not anticipated, requiring a very quick response, rapid response, or needs are being neglected because they're off the radar screen, either politically or for other reasons. And this is the equalizer, if you like, when it comes to funding and ensuring that resources are available for and in such circumstances. And I have to say, over the last couple of years, the Central Emergency Response Fund has been increasing more and has been attracting more and more funding. So there is a recognition among our donor partners that they need to have this fail-safe so that we don't leave gaps out there around the world. On the other part of the question, I think for sure our colleagues in many parts of the world are feeling neglected. There's sadly a very limited bandwidth of attention for humanitarian suffering, and now the scale is at an unprecedented level, and the attention span is even shorter. We move very quickly from one crisis to another without any solutions being left behind. So you've more and more protracted situations and more crises that don't even register at the global level, even though they're hugely significant, not just in terms of numbers of people affected, but the depth of the crisis, the human suffering involved. And I do feel very strongly that we've got to have a recalibration of global political attention around just the scale, scope and depth of human suffering, and I hope that the upcoming World Humanitarian Summit will be an opportunity for a reflection on how many hundreds of thousands, I would say millions of people in fact, are neglected, profoundly neglected, where very, very modest resources and very modest engagement, political engagement towards solutions, development solutions, would make a huge difference very quickly. But it's how to get that attention, and at the moment we don't have it. We don't have it at the global level, and as a result, the numbers in need are growing, and the depth of suffering is also growing. But it's a very good point that our colleagues are making, and there's no immediate answer to it, except to say that we are working very hard at the global level to try now, with the upcoming World Humanitarian Summit, to get attention back on this type of reality, which is all too. It's a reality that is growing week by week, month by month, year by year, neglecting the awful humanitarian suffering that's taking place in so many places, that there's a wholly and totally inadequate humanitarian response.
Thanks, John. Actually, as you speak, another caller responded to what you said about the Central Emergency Response Fund. And the question is, you mentioned there is $500 million that are available to fund through the Central Emergency Response Fund, yet the guidelines of the fund do not allow to fund pre-positioning of aid to be able to respond should a crisis happens. Can you share your reflections? Should the SURF guidelines change, or how could colleagues listening really be able to make the most of being able to pre-position so they're ready to respond? John, over to you.
That's an excellent point, and let's just focus for a second on it's about response. So the fund will pay for response when it's happening. Of course, the fund could be drawn on for many and other demands as well. One of them that continues to arise is this whole question of who will fund the pre-positioning of the supplies. The Central Emergency Response Fund doesn't have sufficient money to be able to reach to that, because that would then come at the expense of responding somewhere. But the good news is that if you do respond with pre-positioned funds, you can get that reimbursed in effect by having the money released from the Central Emergency Response Fund for that response. It doesn't answer the question, though, of how do you get the fund, the supplies into place, and here's where innovation is required. Donors are not as forward-leaning as we would like them to be vis-a-vis getting funding for pre-positioning. They are doing that in some places, and we welcome that, and it's being included in a number of humanitarian response plans. But we also need to share this burden. You have, of course, the country-based pool funds that have often been used to pre-position supplies. They're right there at the country level, and there is agreement at the country level to anticipate and pre-position supplies. But also then at the core funding of organizations, they need also to continue to think through how to encourage donors to give them advance funding. So if you have a program for a year, to get some advance funding that will allow you then to be working off a buffer stock which in the end will be your pre-positioned supplies if the situation deteriorates and you need to tap into even more supplies than you are planning to do for the year. So that's one of the innovations that I think is being pursued by a number of organizations that basically say to donors, look, we have a program here for a year. We are going to feed so many thousands in December. Could you please give us the advance funding for the December distribution now so we can carry that as a month's buffer stock through the year that gives us this pre-positioned capacity to rapidly scale up if something happens. And so on it goes. I mean, we have to think out of the box on this because absolutely, if you don't have supplies pre-positioned, ready to go, then you don't have the capacity to do a rapid response unless you take away from other parts of the ongoing response. So again, very much appreciating this question and that we all have to continue to really try to think out of the box on solutions for it. Thank you.
Thanks, John. We all really appreciate the thinking out of the box and being able to find a way forward, really, in one way or another to enable, indeed, these operations to be able to do the right thing in terms of what is needed to take place. I'd like to move now to Domitil, and actually we have a question that comes from Jordan, which I suppose refers to the Syria operation, but it could also be applied to many other situations. And it talks about what do we do in an emergency situation where basically funding could be available, but the main issue is limited access to populations in need because of the conflict. So how do we really shape a rapid response mechanism in these situations where we have the analysis, we have the preparedness, we have the partners, we have the money, but really access is a problem, and really that's really what hampering our ability. Any reflections on that, Domitil?
Perfect answer. No silver bullet.
There is no perfect solution in these cases, but because NGOs are implemented in DRC for a long time or even for too long, we know pretty much well the context. So each NGO has its own network in order to be able to measure the risk level that we are taking, us and our teams. When we really don't have any access, it's quite rare actually in DRC. It can be for a few days, but it's not very long. And in this case, we can begin to work and to launch activities with the community. For instance, in education, we inform the local directors of schools to begin to integrate IDPs students. Or we are trying to pass by local committee groups to begin interventions. But it's, fortunately for us in DRC, it's quite rare to be really blocked and have no access.
Thanks. I actually have a follow-up question also for you. It comes from Latin America. But Domitil, I think it's also applicable, which is really about the role of the national partners. When and where and how do the national partners come in the rapid response? Have you used them in the DRC? How can one really implicate them a lot more given their knowledge and understanding of the context in the operations? Domitil, over to you.
This subject has been discussed for a long time, and we were trying to think about the best way to integrate local NGOs within the program. And after having analyzed all the different options, we finally decided that supporting the local NGOs has to be done in a quality strategy, has been integrated into our quality strategy, That means that we are working with local NGOs, but it's more about reinforcing our human resources or also our capacities. But we are not at this stage at the point where we are supplying activities with local NGOs, unfortunately. But it's it's a tricky context, and it needs also a lot of capacity, logistical, security, human resources. Congo is also a difficult country in terms of corruption and fraud and etc. So for many reasons, finally, all partners and UNICEF and OCHA decided that the main strategy will be that local partners have to be integrated into our quality strategy.
Right. I'd like actually to go with the same question to Sylvia, because I think we all agree the role of the local partners or the national partners is important. So do you see, Sylvia, a space? I mean, Domitil talked about particularly the political context and complexity in the DRC, but how do you see it from a global perspective, having worked now in several operations or applied the model in several operations? Can colleagues listening to the program trying to engage with local partners in the rapid response mechanism on the ground? Sylvia, over to you.
Yes, thanks for the question, and I think it's an essential one also to link the rapid emergency response to longer-term interventions and the sustainability. Now, sustainability is not at the core of the RRM as it has been implemented, and actually RRM in the DRC has been going on for many years, and yet, as Domito mentions, it's not been an easy way forward. Now, I can take the example also of South Sudan, and here we have seen examples where international partners have had no access in many of the places that have been affected by the recent conflict, especially the 3 states that are most affected. And when some of the RRM teams, UNICEF and WFP staff have directly accessed there, we have found local organizations, local partners that are able to, with some minimum training, some minimum engagement, cash, and supplies, are able to take over some of the interventions when it comes to nutrition screening, surveillance, vaccination, etc. So I think we have to strive to always look at the longer-term capacity development approaches, but at the core of the RRM and the rapid response mechanisms and the areas where we operate, it's always challenging. In Iraq right now, we're in the phase 1 of RRM with the rapid response package that lasts 7 days. Now, how can we sustain the response when some of the displaced populations are settling in host communities, and how we can find ways to work together with the local authorities to provide longer-term solutions to displacements and encourage, hopefully in the near future, also some stabilization and return. That is what the RRM partners are struggling with. But I must say that UNICEF, being both a humanitarian and development agency, working both on emergency response and also longer-term approaches, is thinking about that every day. And this is really some of the core of what we call also resilience, recovery, early recovery approaches that we're striving to implement in all the emergency contexts.
Thanks, Sylvia. And I guess, first of all, in natural disaster situations or in conflict situations, the judgment could be made in each case as to the appropriateness and, maximizing basically the efforts to engage our national partners, colleagues in the response. Sylvia, I have one more question for you, which really asks about the interrelation between the rapid response mechanism and how it differs from the interagency process of conducting assessment and response. So basically, again, coming back to this very unique, specific mechanism versus what is being done within the system. So how do they interrelate? Does one replace the other one? Can you elaborate a little bit further on this structure and how it works? Over to you, Sylvia.
Well, it doesn't replace you know, the interagency assessment mechanisms are the core of the response and also of strategic response planning. But in reality, in many contexts, the capacity to rapidly deploy and undertake multi-sectoral response is not always there. So when you have, for example, newly liberated, like newly accessible places, or that we haven't had access, how we can go very quickly to see what are the needs, because there is a window of opportunities for accessing, but also reaching people in dire need. And sometimes what we see practically is that getting together all the clusters and agencies to agree on the mechanisms takes time. Now, in the DRC, the multi-sectoral assessment tool is very much based on the MIRA assessment and is being used by partners also outside of the RRM mechanism to evaluate the intersectoral needs. In the South Sudan context, there is actually you know, a very elaborate mechanism of multi-sectoral assessments that is taking place, and also the RRM partners complement those. So it's not either or, but it depends on the context of the capacity, and eventually, of course, the aim is to have the access to the multi-sectoral needs assessment so that the response can follow and be truly integrated and holistic.
Thanks, Sylvia. John, I'd like to come to you actually with the same also question on the rapid response. How is it viewed? We've heard in some operations, you know, the critics also to it in terms of saying it's not as inclusive, it does this but doesn't do that. So this is actually the last question I'm asking because we're also running out of time. So I want to ask for your reflections. John, over to you.
Thank you, Panos. Well, I would like to recall the spirit of the transformative agenda, which was that we acknowledged as a community, a humanitarian community, that we'd made things too complicated. We'd made them too bureaucratic, we were too slow. And the transformative agenda was to simplify things, it was to speed things up. And I must say that from my perspective as a humanitarian in the first instance, I really compliment our colleagues in the field who've taken the initiative and run with it basically on this. Yes, for sure, everything that's good can be improved, but this is a fundamentally sound concept. What's the concept? The concept is that we organize ourselves in again, a simple, straightforward way to be able to respond rapidly when people find themselves displaced or in humanitarian need, with a response which is what you would expect and what they expect. Remember, we talk about the centrality of protection, we talk about accountability to affected populations. This is about people expecting the international response to actually meet their needs quickly, their most urgent and most desperate needs, that is. The more complicated we make these things, the slower they will be. That's the inevitable consequence. And what we do in the end, what do we provide to people in so many instances? It is actually rather simple. It's a humble response in so many ways, and therefore we must find the way now to build on these very good examples that are out there, keep it decentralized, at the same time share best practice, and you know, address the legitimate criticisms, if that's what people want to call them, but look at the issue constructively and ask ourselves a simple question: can this be improved proportional to the effort that will be required to improve it? Because sometimes we lose that perspective of time and cost. Proportional to impact. This is about being able to answer people who need a rapid response, that yes, with the capacities that we have, with the supplies that we have, we're doing the best that could be expected of us. And as I have been repeating through this conference call, we have now got a lot of good practice at the field level from a field-devised, field-designed initiative, and let's build on that. And let's also make sure at the HQ level that we are doing our job to support that with the sort of exchange of global best practice, learning, training, capacity building, and of course the other support, making sure that staff are deployed and financial resources are also deployed to equip our colleagues on the front line to be able to do what they are capable of doing and most certainly want to do to meet the needs that are right there in front of them. Thank you.
Thanks, John. Looking at my watch, we have really run out of time. I really want to thank you all, but before closing, I just want to say, to draw your attention to a couple of points, because clearly we haven't answered to all the questions. I can see we're getting many more questions as we speak. We have shared with you a couple of documents. There is actually a comparison paper that was put together looking at the rapid response in the DRC, in Central African Republic, South Sudan, Iraq, and I want to point out that actually for each country model there is a focal point. There is a person who has tried to apply the model who may be of help really if you wanted to kind of zoom in looking at these models and seek some more assistance. I also want to point out to the rapid response mechanism overview document that we've shared, where you also see in terms of cluster what the response, and you would also see that in that document as well there is a reference to each issue where you can link to a website with really quite a lot of information and contact names should you want to go a little bit further to get more details. But bottom line, as John said, is really the ball is out to the field. We've shared with us some best practices today, but really it's all about also looking how to tailor make it within your own context, within your own situation, in terms of what makes sense, and using pretty much the 5 or 6 points that Sylvia shared with us earlier on in terms of pre-financing, pre-positioning, pre-identifying partners, maintaining basically a humanitarian watch, having a light need assessment in place, a light mechanism of discussing with the partners, trying to see how to link it as much as possible to the clusters, to the broader system, looking in particular at possible gaps, looking at protection, looking at a more holistic approach in your response, and bottom line, doing really everything possible, turning every stone to be able really to deliver and help the people in need who are in desperate situations in where you are. You also see in front of you, in your screen, a link in terms of where can I get help to really go and try and get more assistance. So on this note, I'd really like to thank very much our speakers today. It was excellent to have John, to have Sylvia, and have Domitil, bringing the global voice, bringing the field voice, and sharing with all of you some best practices in terms of the rapid response mechanism. There are multiple models out there. This is one of them we highlighted today. There is more. Actually, we'll be happy to highlight also in future webinars. But this was a good example we saw today. I'd like also to point the fact that on your screen you see actually a polling, a questionnaire that I'd like to really encourage you all to go in and give us your feedback on what you thought about this webinar. Was it useful? What aspects of it, what points of it was helpful? What other topics you would like to hear in the future as we are preparing more and more webinars related to the transformative agenda? We appreciate very much your honest, your brutal, your frank feedback in terms of how was this useful for all of you who had been listening. And I have to say a big thank you, because today, in between the 2 webinars that we've run in the morning, and this is the second afternoon, in the afternoon we've had more than 400 colleagues who have really registered to join in, and over 50 countries who have participated. So I do hope it was worth your time, and appreciate for staying with us all to the very end. So from all of us here in Geneva, in New York, in Goma, I'd like to thank you all and wish you all the very best in your response and work on the ground. Thank you and goodbye.